Good afternoon, and thank you for joining us for the third webinar in a four-part series, Develop and Plan Part 2. I'm Heather. I will be running the webinar for you today. As a reminder, handouts are posted that you can obtain in the section on your control panel. Once the webinars have been completed, all the information will also be posted to a website, and you will be notified at that time once it's available online. And here's Caitlin.
Hello everyone, thank you for coming back. We are almost done. Today is going to be exciting because we get to talk about the technology fit for your program. So this is the fun part. So defining your technology. So at this point now you've defined the service that you need, so now you have to define the room where that service is going to happen. So the room that you're going to be having your telemedicine encounter in is going to help dictate what type of equipment that you're going to be purchasing, and don't forget to trial and test. All of the vendors out here, they have equipment there to send for you to trial with, so you can actually play with the physical equipment. If you're looking at video conferencing platforms, they will do demonstrations, and they'll do them multiple times. So you'll be able to really sit down and figure out which works well with everything that you're doing and what everybody likes to do. So defining your telemedicine room. So think about where your encounters are going to take place. Is it going to take place in your ED? Are you going to be out in the field? Are you going to be in a person's home? Or are you going to be in a typical exam room that you'd find in your primary care office? Then also, why are they taking place? Is this going to be an emergency consult? Is it just going to be a regular consult, maybe between provider and provider? Or is it between provider and patient? And is it going to be a continuing care situation where your patient is going to come in and it's already automatically set up as a telemedicine visit? So your basic connectivity recommendations. So for bandwidth that you need, ATA recommends that you have 500 kilobytes per second in each of the downlink and uplink directions. However, talking with other people, most people are recommending to up that to have at least 768 kilobits per second to 1 megabit per second. And this will just allow you to make sure that you have enough of the bandwidth to support appropriate video conferencing capability. If you don't have enough bandwidth, what you're going to run into is, you've seen it before with video conferencing, people are going to come in fuzzy, you're not going to have a clear picture, or you're going to have your sound and the person moving the lips is going to be off, or you might not be able to catch everything that they say. And for video conferencing, when it comes to healthcare situations, you really want to make sure that this feels like an actual face-to-face conversation. Don't forget about privacy, making sure whatever video platform you're going to be using is secure and up to date with HIPAA and high tech. This is where a BAA comes into handy, a business associates agreement with whatever vendor you're going to be using your video conferencing platform for. And then just a little note, when you're looking at where you're going to be connecting this equipment to, just make sure you're going to avoid any long wires. Place equipment where the cords can be safely placed out of the walking path. You do not want anybody tripping on anything. So your physical room. What you're looking for in a room is you want a secure location to discuss private information. And really, when you're figuring this out, just use common sense for how this is going to be set up. You're going to be having private discussions with this person. You don't need to have them out in an open, same as you would with any other type of healthcare encounter. If you're in the home physically and you're with the patient and you're video conferencing with the provider, it's a little bit easier to control. You'll know who's in the house and who has able to access that. If you're beaming into the home remotely, you only have so much control and privacy, but just try to stress to the person to make sure that they let you know who else is in the room with you, who else is in the house, if it's okay for them to overhear this conversation. If you're in an office setting, just look, a typical exam room is fine. If you're not going to have this set up in an exam room, say from the provider end, just make sure there's a room with a door that's in a quiet location. The other big thing is really important when it comes to lighting with this. So as I've said before, you really want to make sure that this looks like a typical face-to-face conversation. And when you're doing video conferencing, lighting is key on making sure that that comes across. You want to be able to adjust the lighting. If you can't, pick a room where you don't need to sit directly underneath the fluorescent lighting. The light should be diffused and in front of the patient, obviously not directly in front. You don't want them squinting. And You don't want them directly behind it either. If there's windows, make sure the glare coming in from the windows is not going to affect it. And common sense, don't face the camera towards the window. There will be problems with that. So the actual room, it needs to be clutter-free. Wall coloring is actually extremely important. If possible, place the patient against a wall that is a light blue or a light gray. White and dark colors will either darken the patient or wash out the patient's complexion. Same goes on this end for the provider as well. Not only does the provider need to see the patient clearly, the patient needs to see the provider clearly as well. So both ends of this telemedicine encounter, you need to make sure you're in an appropriate environment that produces the best possible effects. Camera placement is extremely important as well. Monitoring camera, they should be placed at eye level a little bit above. You want to be able to have a precise view of both patient and provider, and you want to be able to allow eye contact. You don't want to be having the patient feel like they have to look down constantly and can't make that contact with the provider. And more importantly, you don't want to have that provider be looking down or not be able to look directly at what the patient is doing. The patient's going to miss that direct eye contact and won't feel as comfortable. So we're going to look at the individual rooms that you might have a setup encounter for telemedicine. So if you are set up in the ED, you're most likely going to want a cart that can move easily from room to room. You want to be able to connect wirelessly. If you have your workstations on wheels, just model it after that. Almost all of the carts out there are modeled off of that, so nurses and your staff can use it as they would a typical workstation, and they're not trying to adjust to a new type of equipment or anything like that. It's really key when you're getting equipment that, yes, there's a lot of new and exciting things out there, but try to get something that people are going to feel comfortable with. The more comfortable they feel with it, the more likely they're going to use it, especially if it's modeled after something they're already utilizing on a regular basis. So if you're going to be set up in an exam room, your biggest question is this going to be fixed or mobile? Carts have been very popular for everywhere. They're really nice. It means you don't have to have a set designated telemedicine room. Trends right now are going towards people having set designated telemedicine rooms, so no matter the encounter, there's just a room, and then they can go in and set up an entire telepresence system within that room. Obviously, that does not work for a lot of organizations. So if you can have it in a fixed location, great. If you can't, you're going to be mobile. You're going to be jumping from room to room. So if it's mobile, model it similarly what you would do with an ED. If you want to look at wireless or wired, if you want to be able to have it connected to both. Do you want a cart? Are you going to need the peripherals attached? When you do this visit in an exam room, are you going to need to transmit vitals like your blood pressure, or do you need to have the stethoscope or anything like that? If you don't need the peripherals, maybe a simple laptop is all that you need to be able to do this. Just make sure that you have something where you can set the laptop up that allows for the best possible eye contact and best possible lighting within the room. If you have it fixed, you're going to need to look at your size of the monitor, and you need to pick an appropriately designated room. Size of the monitor is very important when you're doing this. You don't really need to have that 70-inch screen if it's just a one-on-one. That's going to be a really big patient or provider head that the patient is going to be seeing on it. So just make sure you're picking an appropriate size for what you need. So if you're in the home, you want to look at connectivity in your coverage area. Is it cell service? Does the person have wireless capability? The equipment you're going to use it, can you hardwire into the patient's phone line so you don't have to worry about that? The biggest one when it comes to connectivity is if there's going to be video conferencing involved. If you're utilizing this strictly with just remote patient monitoring, and all it is the patient is going to be transmitting the vitals that they collect on a regular basis, connectivity is not as big of an issue as it is when you have video conferencing involved. So if you're going to be doing video conferencing from the home, it's really important to trial it in the areas to make sure you're going to have an appropriate connection. It's not going to get dropped. You're going to be able to hear and see clearly. You're also going to want to know how that patient is going to be accessing it. Are they accessing it by themselves with a smartphone or their own personal computer, or is it a visiting nurse that's going to be in there and connecting with the patient and nurse to the provider? And how is that nurse going to be accessing it? Is she just walking around with a tablet where she's going to hold it up in front of the patient, or is she going to have some type of laptop that she's going to be brought in? The other one, what are you monitoring? Is this just a basic checkup? Are you going to be looking strictly at vitals? Is there any education piece that you need to throw in there? And for equipment, this is key for looking at vitals because you have things called peripherals for extra attachments. So you really need to know exactly what you want to monitor. So there's peripherals out there for everything. You've got scales, you've got blood pressure cuffs, you've got pulse ox, you can do spirometers, you can do 1 to 2 lead EKGs for some of the more in the field for EMS style. There's actually 12 leads that you can transmit. So it's really important to figure out exactly what type of data you want transmitted back to make sure you're having the most appropriate setup. Which brings us to in the field. So this is, you can gear towards it for if you're having a home health visit or maybe you're working with EMS or something with that. Same goes to in the home. You want to look at connectivity issues as well as safety issues and what level of equipment that you want to carry. So a lot of these, the picture that I have on there is a typical field kit, and it's basically just a big briefcase that you can pick it up and bring with you, and in it you've got your computer that's got the video conferencing capability as well as the ability to attach the peripherals to it to transmit data through that. And almost all of these work in everything from wireless to 3G, 4G, the MiFi or satellite, so they really try to make sure that no matter where you are, you can at least connect to something. And the other big thing to look at is safety issues when you're going into a patient's home, just as you would for any other home health visit. Just think about that. And then looking at your level of equipment to carry. Is this just something where the patient's just stopping in to check in and they're maybe doing a medication reconciliation? Maybe they just need to touch base with the provider. So really they just need to be able to do a video conference. So maybe all they need is just a little tablet to bring with them that they have the ability to. Or do you want something a little bit heavier duty like the field kit that's pictured? Also look at what you need for peripherals. So what is out there? So there's a lot to choose from, and there is a lot of companies to choose from. And it can be very overwhelming, but you've been able to narrow it down coming up to this stage because now you're going to know what type of program you're going to be able to have. You're going to know what type of area you're going to be able to have it in. So it's going to help you narrow down. Obviously, you don't need to be bringing a monitor with you if you're doing a home health visit. So it kind of helps narrow it down a little bit. But you've got cameras, you've got carts, there's clinical care platforms. Both Cisco and Polycom offer these, and it's kind of that all-in-one where their video conferencing, AMD Global does the same thing, but their video conferencing is integrated. So it's almost set up, you can bring up the patient's chart and all the information and chart it through the program. Maybe you're just looking at a simple desktop, you've got your field kits, you can do a laptop with a built-in web camera, or you can do a laptop with the extra camera attached to it so you have a little bit more mobility with that. Maybe you're looking for a fixed monitor that's going to be in a room. Your peripherals, those are what is going to be attaching to the equipment to monitor your vitals. And pretty much anything you need to monitor, they have for a peripheral. So blood pressure cuff, you got your pulse ox, you've got EKGs, you've got ultrasounds, you've got total body exam cameras, so you can actually look at specific close-up pictures of a person's skin, anything that you want to take a look at more closely. You have remote patient monitoring systems that kind of walk a patient through education and collect and transmit their vital signs on a daily basis. You can do tablets. You can go really big and do these huge telepresence systems that just incorporate everything. Or maybe you have the equipment and you're just looking maybe for a simple video conferencing platform. The video conferencing goes both ways. There's software, but a lot of people are going more towards web-based with video conferencing. So instead of actually having to download and implement this huge software, you just have a web link that you can go onto and sign in for it. So now who do you get this equipment from? And this is not anywhere close to an extensive list that is out there. It's just some of the bigger names that happen to be out there. So AMD Global, they offer carts and peripherals, and they offer a whole wide range. Avizia strictly with video conferencing. BT conferencing, they work with Polycom. They kind of do IT support and helping to get set up that video side. Cardiocom is strictly with remote patient monitoring. Cypher Health does a little bit of both. I'm sure everybody is aware of Cisco. They have a huge presence with healthcare, especially with telemedicine. Dell, if you're just looking for your basic laptop with the built-in web camera, same thing with HP. You've got E+ and eVisit. Both those are your video conferencing platforms. You've got Global Med. They do the same thing AMD Global does. Honeywell is like Cardiocom. They do remote patient monitoring. LifeSize is video conferencing platforms, but they also provide the monitor and the microphone, the equipment needed with that. Logitech provides your web cameras that you need. Philips Telehealth is a whole range of equipment. Same thing with Polycom. Valley Communications on E+ and Valley Communications are resellers of equipment, so they work with all of these other vendors to help you narrow down which one's going to fit. Video is your basic video conferencing platform, same thing with Videron and Zoom. So as you can see, there's a lot of options out there, and if you just don't know where to start, just start asking simple questions. What do you already use? Are you already using Polycom and Cisco? Is there maybe a deal that you can work with to expand upon that? It just all depends. Maybe there's somebody else in the area that is doing telemedicine. Ask them, see what they recommend, and start narrowing it down to that. And also you can narrow it down to what type of equipment you're looking for. So the other thing that is out there, not only can you purchase equipment, but you can work with organizations who provide clinical services. And these organizations, once again, this is not anywhere close to an extensive list, just a few people that are out there. But what these do is they'll work with your organization on developing a plan for what you need, for what you have a shortage of. All of them will rebrand themselves so that when you are working with them and you're contracting with them, when somebody comes to see one of those, it's going to be like seeing as if that provider is part of your organization. And also, if you go with a clinical service, they all have specifications on what type of equipment they may want for visits, so that can really help narrow it down to the type of equipment. So specialists on call, they work with hospitals and they provide neurology, psychiatry, as well as ICU, Genoa and Insight telepsychiatry. Obviously, they provide telepsychiatry, and they do emergency consults as well as continuing care. Upstate Concierge Medicine, they work with primary care and urgent care, and they work with employers, they work with schools, hospitals, basically anything. They're kind of trying to make it as their own for this area. American Well offers a wide range. They started out with direct-to-consumer, and now they're working with organizations to provide primary care and urgent care, but they're also branching out into other specialists. Rubicom MDs, similar to American Well. Telespecialists offer a wide range of different services that you need. So documents. So it's really important as you're going through to make sure you have the appropriate documents in place. So they are all in your handout section, and I will be sending these out as well. Just to go over them briefly, you have a whole list of policies and procedures. Really important when you're implementing something new to have these. And I would highly recommend, if you're going to be doing telepsychiatry, to make sure you have a safety plan in place that focuses on that telemedicine encounter and what to do. The other one is an example of a BAA. I'm sure most of you are familiar with BAAs. For anybody that isn't, this is really good to have, especially when you're working with organizations for video conferencing, anything where you're going to have PHI. This just kind of helps cover it, so if there is a breach or anything happens, it's not all on you. This shares the responsibility of what's going to be covered by the other the vendor you're working with. Credentialing and privileging agreements. This is mainly for hospitals. So if you're going to be using the providers that are not already in your hospital system, so maybe you have a deal worked out with another hospital, or you're going through one of the clinical service companies that were in the previous slide, this is just a kind of an easier step for credentialing and privileging to make sure that that provider is covered at your organization. It kind of takes out a bit of a step. Don't forget too, when you're looking at scheduling for any how you're going to be scheduling an appointment if this is not going to be an emergency consult. The other big one is consent forms. Make sure there is some type of consent, whether it's written that the person is going to be providing verbal consent for the telemedicine encounter, or if they're going to be actually having a written consent form that you'll have on file through that. The other document that's in the handout is the Telemedicine Room design by the California Telehealth Resource Center. This is great as you're going through and figuring out exactly where you want your equipment to be placed for a telemedicine encounter, and it goes over everything I went over, the lighting, the placing, why you want the different colored walls, and what it does if you're kind of off. So it's a nice little step-by-step. It has a checklist in the end to really make sure you're going to be in the best area for your telemedicine encounter. So that is all I have for the moment. So if you have any questions, please start typing them in and I will do my best to answer them. So we have some questions. What about using GoToMeeting? Is it HIPAA compliant and cheap? From what I hear, you can use GoToMeeting. Just make sure that if you have it, the problem with using something that big is sometimes they don't always sign a BAA, so they claim they're HIPAA compliant. You run into the same thing with FaceTime. So it's just making sure that you've got yourself covered with that. But I haven't heard anything bad about using GoToMeeting. Do all of the clinical service vendors have providers licensed in New York State? Yes, they do. Anytime you're going to be working with a clinical service vendor, they will make sure that the providers they are using are going to be properly licensed for whatever state that you're in. So they will make sure that everything is good to go on that end. You are very welcome for the references and examples. Thank you, David. He just said New York doesn't require a separate written consent form for telemedicine. Verbal consent is sufficient, and it is. Just in case you want to have that document to show that there was consent, you can do written, but verbal is perfectly fine. Give everybody a few more minutes to type in any more questions. Oh, I wanted to add in, I know from the very first day, questions keep coming up with reimbursement, especially for private insurers. I've been trying to dig into this, and what I've been able to come up with, at least for doing the actual billing with the coding, you're going to be using the same codes you use normally. Just make sure that there's a GT modifier after it. So with the parity law, the insurers have to cover telemedicine. As for right now, if they're actually billing and covering for it, I haven't heard anything of yet besides with the Blues. The Blues already have a very great support with telemedicine, so you should not have any problem billing with them. The other thing to look at with private insurers is while they do have to reimburse for telemedicine, they only have to reimburse for what they're already providing for face-to-face. So some of them do have restrictions on the originating site of where the patient can be located. I am trying to get more information on that and be able to send it out. And we have, I'm not sure if it's a question or just a note, but it says Oasis does not have a code for it yet. So if anybody is Oasis, I guess there is not a code for being able to bill for telemedicine quite yet. Well, if they're only DOH. Okay, thank you. Oh, we have another question. Medicare does not recognize store and forward in New York. That is correct. Medicare, you cannot bill for store and forward through Medicare. It's got to be video conferencing. You're very restricted to where the patient is located. You have to be in a shortage area in order to even bill for telemedicine. I know the Blues do bill for store and forward for private insurers, and I am blanking on if Medicaid covers that or not for New York State. So if anybody's on the line knows that, chime in, please. Otherwise, I'll look into that. So Medicaid does do store and forward. As for the Blues and other Medicare third parties, no matter who Medicare goes through, if it's through the Blues, through Fidelis, or anybody, Medicare has its own set guidelines for telemedicine. So it doesn't matter what insurer you go through, Medicare is just straight across the board for what it covers, which is very limited. I will send out, after this is done, I will send out what Medicare covers. You're welcome. Does anybody have any more questions? I'll give another minute to see if anybody types in anything else. Otherwise, we are good to go for this week, and I will see everyone next week for our final presentation on telemedicine program planning and implementation.